Hello and welcome to this presentation. This is Ranjana Karki and today I'll be talking about cystic fibrosis. So these are the topic that I will be covering throughout this presentation, and this presentation is generally for register and enroll nurses. Now let's start with the introduction first. Cystic fibrosis is an autosomal recessive genetic disease affecting various body systems. Observations of children with this disease from the 1940s to 1950s highlighted pancreatic damage, which led to severe malabsorption, causing an early deaths and at risk of lung infections. Now let's talk about pathophysiology. Cystic fibrosis is caused by the CFTR, which is cystic fibrosis conductance regulator, which encodes for a protein of the family of adenosine triphosphate ATP. This protein functions as a chloride channel in epithelial cells by stabilizing them at the apical membrane. Mutations in the CFTR gene lead to defective chloride channels, resulting in abnormal ion transport across cell membranes. So, when the CFTR gene is mutated, the resulting protein either doesn't function properly or isn't produced at all. In addition, this disruption impairs the movement of chloride ions, which in turn affects the transport of other ions like sodium. Liver abnormalities are common in persons with cystic fibrosis, with up to 32% affected by 25 years of age, and it is fourth leading cause of death. Multilobular cirrhosis is the most significant form of liver disease, inflammation fibrosis, and presents at a median age of 10 years. The obstruction and stasis of bile cause inflammation within the liver. Chronic inflammation triggers fibrosis as the liver attempts can progress to cirrhosis, characterized by extensive scarring and loss of liver function. Now let's talk about cellular liver pathophysiology. The CFTR channel normally facilitates the transport of chloride ions out of cells, which helps to maintain the balance of salt and water on epithelial surfaces. By maintaining this balance, the CFTR channel ensures that mucous membranes thin and fluid, facilitating its movement and clearance from surfaces like the lungs and digestive tract. Respiratory system. Cystic fibrosis airway epithelia have reduced or absent CFTR mediated chloride ion production coupled with elevated epithelial sodium ion channel reabsorption. These alternations are harmful to cystic fibrosis airways because they result to airway dehydration, mucus obstructions, and impaired mucociliary clearance, and many more chronic bacterial infections and inflammations. Now let's talk about pharmacology. The drug class is mucolytics, and the example drugs is donase alpha, which is also known as pulmozyme. Donase alpha is a highly refined solution of recombinant human deoxyribonuclease. The enzyme can be normally found in human tissues. However, as a drug, it is produced microbially and delivered via inhalation. Now let's talk about mechanism of action. Donase alpha is a cystic fibrosis medication that works by breaking down the extracellular DNA in the mucus. This DNA is derived from lysed neutrophils, and it helps in the viscosity of the mucus, making it easier to clear from the lungs and helps to improve breathing, reducing the risk of infections such as chronic cough, difficulty breathing, which are common in cystic fibrosis patients like Jacob. Now also talk about how donase alpha manages cystic fibrosis. Let's discuss about the symptoms of Jacob first. He experiences chronic cough and difficulty breathing due to thick sticky mucus in his airway. Therefore, the only treatment method will be donase alpha. Donase alpha will help break down the thick mucus, making it less viscous and easier to expel. This will also mitigate the frequency and severity of respiratory infections and improve Jacob's overall lung function. So, with the regular use of Donis alpha, it helps Jacobs experience fewer hospitalization and better control of his respiratory symptoms. Now let's talk about nursing consideration. Dornis alpha is administered via nebulizer. Um, it is very important for registered nurse and enrolled nurses to make sure that patients are educated about the correct use of the nebulizer and the significance of regular treatment. Frequent monitoring or assessment of the lung functions is significant to gauge the effectiveness of Dornis alpha. Watch for potential side effects, including voice changes, throat irritations, or rashes, and make sure patients report any kind of unusual signs and symptoms. So, lastly, coming to the conclusion, it is significant for the register and enroll nurses to be attentive about pharmacological management, especially with Dornes alpha, as it is vital in improving well being by mitigating mucus viscosity and alleviating respiratory symptoms. Proper nursing care not only involves administering medications but also educating patients is very significant as well. Thank you so much for listening to me, and I have attached all the references in my last slide of Sway. Thank you.